Does anything stand out about our first couple of appointments together?
So there's two things. You'd had some really bad experiences in the healthcare system with respect to weight, and yet you were still really hopeful and very positive, and that's something that I was very impressed by. The other thing is you came in, you were carrying a lot of excess weight, and many people equate that with being lazy or stupid or not working hard and all that. And you talk to you for 10 seconds and you see how intelligent you are, how accomplished as an attorney you are. And I think it's just such a great example refuting what many people's assumptions about obesity and people with obesity are.
How do you approach a new patient?
Well, of course, every patient is different, but one of the typical types of patients we see are patients with pretty severe obesity and some pretty bad experiences in the healthcare system. They aren't always so ready to open up about their experiences and about their weight and about their vulnerabilities. And in those cases, we take the smallest little steps forward, just starting to get a little momentum and starting to help people feel a little more comfortable and a little more open to change. And usually then we're able to go from there.
So you've talked about experiences in the healthcare system. What sorts of things have happened to patients that you're now seeing?
Yeah, well, as you know, unfortunately, there are lots of stigmatizing and shaming experiences that happen in the healthcare system with respect to weight. Sometimes it leads to some pretty terrible outcomes. There's a patient of mine who ended up having a pulmonary embolism, a blood clot in her lung, and when she went to the urgent care center, they didn't even listen to her heart or her lungs. They didn't do any tests. They just told her, you have chest pain because there's too much fat pushing against your lungs.
Wow.
So that's an example, a stark example, but an example of what can happen in the healthcare system when weight bias and stigma gets in the way of good health care.
Can be deadly.